Hi, I'm Joanne Conroy, President and CEO of Dartmouth-Hitchcock and Dartmouth-Hitchcock Health, and welcome to our Facebook Live. Today, we are joined by Dr. Michael Calderwood, who is our infectious disease leader and Associate Chief Quality Officer here at Dartmouth-Hitchcock. Many of you may have made his acquaintance virtually before, as he's appeared on a number of our Facebook Live presentations, and he certainly has been an integral part of our incident command structure that we established in March when the coronavirus first presented itself in the Upper Valley. Now, a couple things that we'd love the audience to do is, number one, if you have questions as Michael goes through some really important information about COVID-19 and the impact it has on not only our Thanksgiving travels, but the impact it has across the state and the nation, that you submit your questions on the Facebook Live news feed. We've already received several of them. I know most of our Facebook Live presentations have been conversations with individuals, but we have so much information to share. It's really a conversation between Dr. Calderwood and the audience. And we are additionally going to touch a little bit on what we could expect from the introduction of at least two of the vaccines that are under review for emergency use authorization currently. So Michael, let me just kind of let you roll with the information that Michael presented to our senior clinical team this morning. And I thought it was so well done that I think it's important to share with the entire community. So Michael.
Thank you very much, Joanne. So I'm going to go through some slides, and I hope it will start a conversation. So I look forward to folks submitting questions, and we will get to those later on during today's session. On the screen, you should be seeing some projections of the trends here in the state of New Hampshire. And this really mirrors what's being seen around the country as we have entered a second wave and are seeing a rise in cases of COVID-19. Across the state of New Hampshire, our 7-day average is around 340 new cases per day, and these are individuals who are tested and have a positive result. There are a number of different tests that are out there, but these are aggregated at the state level. This is quite a bit higher than the count that we saw in the spring, but at the same time, we're doing a lot more testing than we did in the spring, and we have a lot more availability of testing. If you look at hospitalizations, for a while we were just seeing a rise in community cases, but not seeing the hospitalizations following on. But over the past few weeks, we really have begun to see hospitalizations in the state ramp up. Yesterday, the number here on this slide is 77. It's actually up to 83 today. And our number locally at Dartmouth-Hitchcock Medical Center has been on the rise as well. In addition, as we are doing testing, we keep a close eye on the percentage of our tests that are turning positive. And we're nowhere near where we were back in the spring, where we had very high positivity rates. And that's a good thing. The lower that number, the better you're doing with doing sufficient testing and really testing all the people that think they may have disease. As that number begins to creep up, we know that there are cases that we are missing. And so as we've seen this rise, it's estimated that there are probably around 5 true infections out in the community for every case that's getting reported. And this is important for folks to know. You see the numbers on the news, but there are individuals who are asymptomatic or mildly symptomatic who may not be getting tested. And many have seen that all New Hampshire counties at this point have substantial community level transmission. We've looked closely here at Grafton County, where the medical center is located, but you can see the entirety of the state in red. And the state has come out with wording to say that containment is no longer possible. And that's scary when you first hear it. And I just want to talk about that a little bit. And what that means is that more and more resources are being dedicated to testing individuals who are symptomatic. So we're going to be doing less asymptomatic screening. And particularly as people come back for the holidays or travel for the holidays, we get questions about, well, can we screen my entire family who's coming for Thanksgiving, or we have people coming back into the area. We can do some of that testing, but as we do more and more symptomatic testing, we have to be aware that there are going to be limitations. In addition, we can't reach everyone in a timely manner. The state has put incredible resources into contact tracing, but we know that about 50% of people don't pick up the phone when the state calls. And so there are delays in initiating quarantine, either because people are contacted late or never contacted at all. And so there may be people who've had contact that aren't aware of that. There's been a call for the state to really ask healthcare providers to help with this education of people who are testing positive, and for those who test positive to reach out to their close contacts to tell them that they may have been exposed. All contact tracing has not stopped, however. And I think this is important to recognize. It is focused now on highest risk populations, really focused on children in school settings, in the elderly, particularly in long-term care facilities, but also looking at clusters and outbreaks as well as disproportionately impacted groups within the state. So what does this mean for all of us? It means that we need to begin to switch to mitigation. And there are a number of things that go into that. The first is a focus on masking. And I show this just to really highlight that New Hampshire is a bit of an outlier. Many states have gone to universal masking. And even within our state, you can see many of our towns have not yet made this mandate. But you can really set an example. You need to wear your masks when you are out in public. And this is really going to be a big factor in decreasing the spread of this illness. Hand hygiene. People ask me, does it make a difference? What I can tell you is that the virus can survive on your skin and on your hands for 8 to 10 hours. If you've sneezed on your hands, it can be even longer, out to 12 hours. 15 seconds of washing your hands with an alcohol-based hand sanitizer can actually inactivate the virus. And this is critical. What about travel? Really, at this point, there are not any safe states left. Even Vermont has begun to see a rise in recent days. And so we have to take this into account as we're thinking about upcoming plans for the holidays. Within New England, if you live in New Hampshire, we currently can travel anywhere in New England without quarantining on return, but we know cases in Massachusetts, Connecticut, and Rhode Island have been increasing. In fact, even though New Hampshire allows you to travel, there are many states that don't want us to travel and say that we need to quarantine if we go there. Some recent examples would be Vermont, New York, New Jersey, and Connecticut that say that, why don't you stay home? And so the state has really been emphasizing that you should not be participating in non-essential personal or business travel. And when we celebrate the holidays, need to be thinking about celebrating with our immediate family and not bringing large groups together, particularly across state lines. A lot of people are worried about the schools. I will just highlight for folks, the schools have done an incredible job and a lot of policies put in place. We continue to have cases that pop up in the schools, but very few clusters. And so the transmission isn't actually occurring in the schools, it's occurring outside the schools. And so we know that transmission is occurring at parties and sleepovers. Carpools are a big one, and the ability to wear a mask if you are carpooling with people not in your household, as well as sports, particularly when you're not wearing a mask or they occur indoors, or travel to and from, and a lot of work to limit that travel across state lines. So things that we can really do. And this last one is the one I want to focus on for the holidays. Social distancing. And this is a really nice model that was looking at a party. This is a living room, 6 individuals, no masks, windows closed. And what you see here is over a 4-hour party, everyone in that room gets COVID. If you open the window, everyone's wearing masks, we have ventilation. All of a sudden, you limit it to 2 hours and you're less than one of those individuals. Smaller is better. Outdoors is better than indoors, If you're indoors, you want to be ventilating, and masks really are important, particularly if you are congregating with those outside of your household. We can do a lot to celebrate this year, and I think we really want to focus on that. This is a time to spread hope, and there really is hope, and we'll get to the vaccine, and I think in the upcoming months, we're going to see things changing and changing rapidly. But if I look out a month, I have concerns, and I think that we saw what happened in Canada with their Thanksgiving celebrations, and we need to learn from that, and we need to realize that if we're not making good choices, it really is going to impact our larger communities and lead to quite a bit of spread that will lead to increasing numbers in our hospitals and sadly increasing deaths as well across the state. If you're going to celebrate, what we say is immediate family is great. You can create new traditions, whether that is trying out new recipes, having each member of the family try out something new. There are also people that are thinking about unique ways to do potlucks. Everyone makes something and then delivers it around. You don't go into the home, but you at least deliver those dishes. We do have to recognize that there are people that are going to be isolated during this time, and particularly family members that may live alone, the elderly. We want to be thinking about how we include them in celebrations, but not put them at risk. And reaching out, making those deliveries, finding a way to connect is going to be important. If you choose to get together with people, again, could you do that outside? Can you spread the tables out? Do you wear masks? We want to ask that people really limit the number of people serving food. We don't want everyone going at the food at once. There are things that can be done. I know a number of people are saying, I'm going to have an outdoor film festival. That sounds great. You can do this with social distancing. This year will be different. It will be one you remember, but we will get through this.
Great. Well, thank you, Michael. I do want to remind viewers to go ahead and put any additional questions you have on the Facebook Live news feed, and we have a number of questions already. I do want to really kind of ask the audience to really rethink your Thanksgiving plans. And I know many of you are probably weighing the risk versus the benefits. And I have a 96-year-old mom that's living with me post-stroke. And you know, even though we can quarantine a lot of our extended family members as long as necessary, you know, it just doesn't make sense. And we've reevaluated our Thanksgiving plans and agree that this will be a unique Thanksgiving. We'll be spending a lot of time on Zoom.
Yes.
And we'll have we don't need a gigantic turkey, but we'll probably be thinking about a turkey breast and a couple legs. So it's going to really pare down a lot of the preparations, but we realize this is just 1 year out of many. Talk a little bit about the numbers. Mm-hmm. And, you know, I know I'm asking you to look in your crystal ball, and you have said before, you know, projections are good for about 10 days to 2 weeks, and that's all. Yep. But I just want to set people's expectations about what we could see across the state over the next month. There is always a peak and then a decline in cases. We know that will happen. But, and I know you've been working with the people at the state, really kind of talking about what it could look like. What do you think is the range of cases that we may see across the state, you know, towards the end of November and into December?
It's a great question. And so the estimates at this point are that we are expecting somewhere between 500 and 1,000 new cases per day at the end of November. I will highlight again that there may be 5 times as many cases that we're not diagnosing. And so that number begins to become quite large. Mm-hmm. And so again, this is out there. Mm-hmm. We need to realize it's out there. And so we can do things when we're out and about in the community to mitigate our risk, yeah. But it is out there.
Now, you did say that Canada had their Thanksgiving holiday. Isn't it early in November? Or is it in October?
October, I believe.
Okay.
Actually, yes.
And then what specifically happened in Canada? How high did their cases go? And did they do a lot of traveling?
So, you know, areas around major cities where they had a lot of transit, they saw a very large second wave, and friends of mine who work in hospitals there were at a point where they were again struggling with ventilators and beds. And it was a really kind of tragic thing to see. It could have been prevented.
Yeah.
And they really realized after the fact that they didn't message as well as they should have.
Yeah, which is why I think in the U.S. we're trying to message very aggressively to really consider your Thanksgiving travel plans. Let me ask some questions first from the viewers that are really specific to COVID. They say, if I'm coming from Connecticut without stopping, will a car be stopped in Vermont on their way through Vermont to New Hampshire? Obviously, they're thinking about driving up 91.
Yes. No, you can transit through the states. And so, many of these states that have travel restrictions do have exceptions. And so, for instance, if you live in Vermont, you're allowed to travel for work, for school, for medical care. That's really important for our patients to know. But, there are also, exceptions for shopping. So, we do have to cross in the Upper Valley state lines to do certain things around shopping, and that is allowed. It's really if you plan to stay in Vermont that things begin to get imposed.
Okay. Another question from a viewer is about sharing a holiday meal with others for a socially distant but connected experience. So we had talked about serving people instead of having them serve themselves. And but she asked, are there any special cleaning or sanitizing that needs to happen as the giver and the receiver?
It's interesting. It's not very hard to kill this virus. And so I do think, your standard, Lysol wipes are going to kill this for washing down your counters. We're more not thinking about surfaces as much as droplets and the air.
Right.
And so it's how do you separate people? Do you, instead of have one table, have separate tables? When people are congregated together, can you do that with masks? There are ways to do it. People often ask, is there a safe number? And there's not, you don't draw a line in the sand and say this is safe and that's not safe. The more people you have, the higher the risk. It's hard to open a window as we move into the winter. It gets very cold, but ventilation is important.
There are questions about college students coming back home for the holiday break. And if they have been at school out of state, should they quarantine for a certain amount of time before interacting with the whole family? And I think the next question would probably be, and if I think they need to get tested, where do I go? And the request for asymptomatic testing for kids coming home is probably going to be significant.
It is, and we've been hearing a lot about that. What I would say is actually many colleges are already doing routine testing of students. So many students who are returning may have had a recent test and have some sense that they are not carrying COVID-19. We know that tests aren't perfect if you don't have symptoms. You tend to have a lower viral load and we can't detect it as well when we're looking for it. What we are focusing on for individuals that are returning, and nicely the states are beginning to align around this, is at day 7 after you return, which would be a typical incubation period when we'd be more likely to have a positive test, we can test someone. And so while we used to say you need a 14-day quarantine, we can test at day 7 and say you're negative, and in Vermont and now in New Hampshire and other states, we can end that quarantine early. And we're focused on that time period. We think that the testing is going to be more accurate at that time period. There are places you can go to get testing earlier than that, but just be aware there are false negatives, and we have to be worried about false reassurance.
Right. The rapid test is less sensitive.
Yes.
And then probably even less sensitive when someone has no symptoms at all.
None of the tests are actually approved by the FDA for asymptomatic testing. We use them, but they're not perfect.
They're not perfect. Another question from a viewer. If you're a walker in a rural area, should you worry about somebody on a bike that's riding uphill in your path?
So that, this has come up a lot. And so when we think about exposure, the exposure we think of is prolonged exposure within 6 feet of someone who is infected, and it really has to be, 10 to 15 minutes
Mhm.
of exposure. So those brief passes when you're passing someone walking, running, biking, I think a lot of us have gotten used to people pulling up the masks, and that's kind of a sign of respect. But those aren't the highest risk interactions.
Yeah. I was counseling some of my nieces and nephews. I said, really, it's don't go to coffee shops, don't go to bars, don't go to restaurants, don't go to cafeterias, don't go anywhere where you take your mask off.
Bars are particularly problematic.
Yeah. Another question for a reviewer. People all want to know, is this going to be safe? Is it safe if all the parties wanting to get together quarantine for 14 days prior to gathering? It really depends on their ability to effectively quarantine.
It does depend on their ability to effectively quarantine. It also depends on where they're coming from. And so there are communities where we're seeing a lot of cases, and the likelihood of someone being asymptomatic goes up as there's more community activity. Do you say just in your house for 14 days, do nothing else, get in a car? You can lower the risk. It probably never will get to zero, but you can definitely lower the risk.
Yeah. Oh, another question. How accurate do you feel the COVID-19 tests are for people doing the self-swabbing at drugstore drive-ups? Oh yeah, and I also want to have a question of that new at-home test. I don't know how many people would insert that swab as deep into the nasal cavity as a healthcare professional will.
Yes.
I totally agree with this person.
So this has been looked at, and actually our lab has done a lot of validation. If it is observed collection, you can actually make sure that someone goes deep enough. The test that we are doing at kind of the health facility-based clinics is a fairly deep nasopharyngeal swab, and that is going to collect the best specimen. Overall, particularly if someone is symptomatic, you often have things dripping forward in the nose, and we can detect. I would say for asymptomatic testing, definitely not as accurate.
They have to tickle the bottom of your brain.
You do.
Yes.
A brain biopsy is what we often joke about. Yes.
Now, so there was a news flash on the new at-home test, which, I do say that if we actually would have an effective at-home test, it could be a game changer for people to make sure that they were not positive before they left the home. Now, this is the first one that I think we've seen. Any intel on it?
I don't have enough information yet on this specific test, although I did read the same news reports on it. What I'm concerned about is we have seen discordance where these rapid tests are negative, and they're in short order, a day later, a more sensitive test is positive. And it's possible that if you'd done the sensitive test a day earlier, it would have also been negative, and it's just the arc of someone's progression. But this discordance worries me against, again, this false sense of security. And I'd like to try and use the most sensitive test we can.
Let's talk about the vaccine.
Yes.
I know we haven't had a lot of vaccine questions because people know we're going to talk about it. And, it's really amazing that we have two vaccines that have been produced in such a short period of time with such a high efficacy rate. And I understand actually I think it's the Pfizer vaccine has something to do with Geisel. And a lot of the researchers here that developed some of the kind of components of actually creating the vaccine. So yay for our researchers here at Geisel. So tell us a little bit about the vaccine. There's not going to be a lot to begin with. Who's going to manage that? I'm sure people in the audience are going to say, when can I be vaccinated? And that's
an important question. So yes, we have two vaccines that we actually think will be available under emergency use authorization by the end of the year. Both are a fairly novel technology for vaccine delivery, which is how they came to market so quick. It does have some limitations on the scalability for production. So while you develop them and test them very quick, we can't get as much out as quick. Now, we will do it much quicker than anything's been done before, but many will be looking at receipt out into 2021, not
Mhm.
at that December
Right.
launch date. So I think that's important. The early efficacy data is amazing,
Mhm.
and many were hoping for 70%, and we're
Yeah.
hearing numbers of 90, 95%. In
Which
fact,
is incredible.
incredible.
Yeah.
These are early data, and the efficacy is based on protection at 1 month.
Mhm.
And so, I would tell people it's possible those numbers will be shifted down over time. And we know that immunity from vaccines, depending on which one you get, can fall off over time. That's why we get a flu vaccine every year.
Right.
So there are vaccines you get, and it confers immunity for a long period of time.
Mhm.
And there are vaccines where that wanes. And we're still waiting to get a sense of how long that immunity will last for the COVID vaccine, and that's going to be important. The other thing that's been great in the early data is they appear to be very safe.
Mhm.
I will highlight to people that we often have to give vaccine to millions of people before we see some of the rarer side effects. But there was a lot of news about vaccine trials being delayed. That was just the research going the route it should and taking a pause. But actually, the data on safety is quite good.
Yeah.
And so if we think about where we are, Pfizer is thought to probably have vaccine available the first week of December, Moderna later into that month.
Mhm.
They're a little bit different in their storage, which is going to impact distribution.
Mhm.
The Pfizer vaccine requires a deep freeze, so it has to be in a minus 80 centigrade freezer. The state actually has a whole bunch of them and can store hundreds of thousands of doses. But this is being managed by the federal government distribution through the National Guard out to the states. And then they're going to be distributing. And there's been a lot of work on that distribution. I was actually really excited about how much thought really had gone into it. It's not finalized, but actually a lot of work. The big thing now is prioritization. And we know everyone wants the vaccine. And so there's a lot of work on kind of who gets it first and which populations. That work is still going on.
Okay.
I do know that healthcare workers, first responders, those working kind of in nursing homes where we've seen a lot of unfortunate impact, will be at the front of the line.
Yeah.
But very quickly, we're going to be getting vaccine every couple of weeks.
Yep.
We can roll this out. So.
Yeah. So I did ask Michael, I said, maybe I'll set a good example and be the first person to get the vaccine. And he said, no. He goes, you are not taking care of patients directly. You are going to the end of the line. So if anybody asks me why I'm not leading, that's not because I'm not willing, but it's actually not the appropriate use of the vaccine, which should go to a frontline provider.
And that is really where we are going to be focusing.
Yeah. Yes. Great. So thank you, Michael. This was really great. I want to thank you for everything you're doing for Dartmouth-Hitchcock Health and our community. It's really impactful. And we want everybody to stay safe, rethink your Thanksgiving plans. Remember, it's not just about you, it's about everybody you care about. And as our new slogan is, stay strong, masks on, that is the most effective way to actually prevent the community spread. Thank you.